Patients just want to go home after being hospitalized, but too often they bounce back as a readmission, causing disappointment and suffering for the patient and financial expense to the payer. Tango is working to make home care better and reduce total costs. Welcome to Health Biz Briefs. I'm David Williams, president of Health Business Group, here with Tango CEO Brian Lobley. Brian, thanks for joining me today.
Thanks for having me, David.
What is the role of technology in clinical care management at home?
I think it's critically important that technology can connect patients for the services they need. So whether that's active communication or things like remote patient monitoring, so they can communicate with their doctors more easily to understand how they're trending at home. And I also think we're basically just at the dawn of what kind of home enablement technology can be. I think we're going to see this accelerate a lot the next half of the decade.
What are the particular home health challenges that you have when you're taking care of dual eligible patients, that is, the patients that have both Medicare and Medicaid eligibility?
I think first there's a higher kind of need. So there's a more services needed, and that bumps right up against the supply challenges that we see in the marketplace today, where there's just quite frankly not enough supply to meet whether it's Medicare Advantage or duals. And then the duals tend to have more complexity, polychronic. So they're probably needing more visits, they're needing more follow-up care, and they're needing access to potentially more services. So we're going to make sure we match kind of need with supply. And that's an increasing challenging as you get into, say, rural markets where, supply is more limited. So we're trying to bridge that gap and make sure we can kind of marry the need with the supply as efficiently as possible.
Brian, before arriving at Tango, you had a lengthy career at Independence Blue Cross. What was that like, and how did that prepare you for what you're doing at Tango now?
It was a great experience. I think I got to see the business from the risk side. So we had a very large Medicare Advantage book that I was accountable for, understood the need of seniors, and understood really how to bridge kind of that need between care delivery and management of risk. So kind of to see healthcare from a really broad macro lens, now being able to dive deep in a specific subsector of that business, post-acute, have the understanding of the kind of funding challenges that are present. So it's been a great experience for me to pull in from IBC into Tango.
So we're just a little bit of the way into 2024. How are you looking at the year? Are you optimistic about how it's going?
Very optimistic. I think more and more, Medicare Advantage and duals payers are understanding the need to drive efficient, outcomes-driven post-acute care. So I feel real great about where Tango sits and really bullish around where the market's going for post-acute care.
Well, Brian Lobley, CEO of Tango, thanks for joining me on Health Biz Briefs. If you like what you hear, check out my Health Biz podcast for a full-length interview with Brian about his life and career.